Well, a warm welcome to today's talk, Friday the 12th of August. COVID cases in the UK are absolutely plummeting, at least symptomatic cases. We'll also be looking at the slightly more complicated situation in New York with COVID and indeed polio, looking at COVID for all of the United States briefly. And if you don't fancy that, skip to the last 5 minutes and get a great update on our work after the floods in Uganda that a lot of you watched a few days ago. Now, just moving to the first orientation picture, we see a great increase in COVID. This is BA5 driven in South Korea and Japan. We're not testing that much in Australia and New Zealand, but we do believe this is a genuine reduction. So South Korea and Japan massively increasing cases, despite South Korea have given more doses of vaccine, as far as we know, than anywhere else in the world. So unfortunately, the high levels of vaccination in South Korea aren't preventing the current increase in cases, which doesn't surprise us because of the immune escape that we know about well. Patients in hospital. Now, Japan is increasing. A lot of elderly in Japan, of course. United Kingdom going down, Australia going down, Canada roughly level, United States down a little bit, and Ireland down quite a lot. So that's why I believe that the cases are genuinely going down in Australia, because the hospitalizations are going down. So that's pretty encouraging. Cumulative deaths, just to put this in context, the United States and the United Kingdom do need to have a pretty hard look at their comorbidities and the way that they were treating these patients. Probably mostly looking at the comorbidities, because compared to other countries, we have not done well at all. Good to see South Korea, Australia, New Zealand and Japan still with relatively low levels. And despite the hospitalizations in Japan, we see that deaths have not yet increased very significantly. Now let's go straight on to the situation in the United Kingdom now. The R value is 0.8, so it's going down quite dramatically. It's still very high, 120,000 new symptomatic cases per day. Prevalence is still high. This is people with symptomatic COVID at the moment from the Zoe study. That's the direct link to Professor Spector's talk. Down in all ages and all regions, which is good. Past 2 weeks, symptomatic cases down 46%. Prevalence is 1 in 26, so still pretty high. Still nearly 1 in 4 have got it. Down from 1 in 16, so that's good. And here's the trend that we've been following. And it's going exactly the way we anticipated it would. And we expect that this will carry on going down in terms of prevalence. Now, I'm confident this is going to go down for August and I believe September. What happens in October? Really, we haven't got a clue. I'm quite optimistic because there's a lot of immunity being generated at the moment. So I'm fairly optimistic, although we simply don't know because it hasn't happened yet, obviously. Case numbers, which are irrelevant because we're not testing much in the UK. This is official data now, but they're down 23.7% on the week. Hospital admissions, just over 6,500 over the week, but down 14.9%. So these are encouraging. These are encouraging reductions. So we are seeing a high prevalence in the UK, but low hospitalizations, which is again what we expected. 827 associated deaths over the week within 28 days of a positive diagnosis, although we're not given data on whether these are with or from COVID, but it is down on the week. Now let's have a quick look at the BA5 symptoms, which we've got an update on. Just before we do that, I'll show you this is the situation in the United States, what we call the nowcast. And we see that BA5 has just increased dramatically. So these are the cases of BA5 here. BA4 is going down a bit, BA2 12.1 down, BA2 now officially doesn't exist in the States at all, so BA5 completely taken over. Good to see the American data so up to date. The UK data is not as up to date as this because the US data is being renewed weekly, which of course is excellent. But let's look at the symptoms now. Now, the amount of people getting symptoms are reducing. So these are the symptoms at the moment, as of the latest Zoe symptom tracker data. Sore throat, still most people are getting a sore throat. 57% of those testing positive getting a sore throat. Headache, 47%. Now, Tim Spector didn't actually say on his recent talk, but I'm pretty sure that sore throat is by far, if you've got a sore throat at the moment, it's more than likely that it's caused by COVID. So that's the most common cause of sore throat in the UK at the moment, almost certainly. But 57% of positive cases who are symptomatic get a sore throat, headache, a non-productive cough, so people are coughing but not producing mucus. Blocked nose, runny nose, cough with phlegm, a productive cough where they are bringing up sputum, 35%. Hoarse voice, sneezing, fatigue, muscle pain, dizziness, swollen neck glands, only 13% now getting fever, really quite low. Altered smell, sore eyes, 13%, chest pain or tightness, 11%. Hot flushes, interesting new one there, 11%. Chills or shivers and loss of smell. So they are the symptoms that are associated with BA5. And I think we can assume pretty safely that BA5 is now representing, I would say, well over 90% of UK cases, well over 90%, based on the US data, which is more up to date. Now, United States, daily new cases, just over 100,000, of course, most not being reported, but it is down. So, yeah, there is a downward trend there, but we can't say too much from that. But wastewater surveillance is interesting. Now, this is SARS coronavirus 2, viral ribonucleic acid in the wastewater. Now, the US has really improved quite dramatically on this. They've now got over 1,000 testing sites, which is really quite an impressive improvement in US surveillance. Most of the country levels are described as moderate to high. So we've still got huge amounts of COVID in the UK, although it's going down and people are getting fewer symptoms. And in the United States, we have to assume it's still high because, as we'll see from these reporting sites here, about half the sites reporting seeing some of the highest levels since December the 1st, 2021. So the highest levels in Omicron, yet hospitalisations are actually slightly, well, they're more or less flat in the States actually, but very high levels. So basically this virus is everywhere in the States. There's a very high prevalence. I think we can say that from this surveillance here. Sites reporting an increase 41%, about 50% of sites showing a bit of a decrease. Now, BA5, as we've said, often with these common cold type symptoms, very common in the States. This is up to date, so it's basically 90% of cases of BA5 now in the States, 88.8. The BA4 is accounting for about, 10.4%. The BA46 just being a derivative of the BA4. BA2 12.1, way down. BA2 no longer there officially. BA1's no longer there. Delta, none, and others, none. And BA2.75, which we were worried about, is not listed, therefore I'm not worried about it. And given that this is not listed in the US, I would expect when we get the updated UK data at the end of August, it will show very, very low levels of BA2.75. Hospital admissions in the States, daily average 6,000, but that is down slightly on the week. But as we've established, I think the virus is very, very prevalent in the States. Deaths, current 7-day average is still 400. Again, no data on whether that's with or from, but it is down a bit on the week. Now, just before we go and look at the improving situation in Uganda as a result of your contributions, we'll just remember the total deaths in the United States from COVID, over 1 million officially. The real number is going to be higher. We know it's higher. If you look at my Wikipedia page, apparently I've been constantly underreporting deaths, but here I'm clearly saying, as I have said, it's not a laughing matter at all, it's just ironic. There's so much misinformation around. This is why we have to go by the evidence. That number of deaths in the States is an underreporting, sadly. Now, polio in the United States, poliomyelitis. Now, there's a very important implication from this. Now, there's been one adult diagnosed with paralytic polio in the in New York area. But in adults, it's only about 1 in 75, 1 in 100 actually get symptomatic paralytic polio. So we can assume that there's many more cases. In children, we don't know what the situation is in the States, but we know in children, for all the cases of polio infections, probably a very small number of children get paralytic complications, very small number, thankfully. But in adults, the percentage that get paralytic complications is more. So we can assume that there's polio spreading amongst adults in the United States. And the adult who was symptomatic, in New York area, not in the United States, this is localized, in New York area. The adult who was symptomatic, we believe, is unvaccinated. So very important for adults to be vaccinated against polio. So if you are an adult in the New York area particularly, or anywhere in the States, do just make sure you're covered for polio. That is well worth doing. I had a booster myself with tetanus last month. Poliomyelitis, New York Department of Health, detected in early June in wastewater samples. 7 positive cases. Now, Rockland and Orange County. Now, I believe these are both metropolitan New York areas. But the cases there are genetically linked to a case of paralytic polio in Rockland County. I think that's in New York City. Correct me if I'm wrong. So it looks like a fairly isolated cluster of wastewater samples. Optimistic that that's isolated, but unfortunately, I do still believe it's necessary for all adults to be vaccinated against polio. This is nothing to do with COVID vaccine, completely different thing. Personally, I'm vaccinated against polio, and as I say, had a booster last month. The reason I had the booster was not because of this outbreak, but I needed the tetanus. I had the tetanus and the polio together because of plans to work in an endemic area shortly. Anyway, transmission of polio virus that caused paralysis and potential community spread. So yes, there's some, but it's limited because they're genetically related. Now, in the London cases, there was more genetic diversity, indicating more potential community spread. Underscoring the urgency of every New York adult and child to get immunised, which we would agree with, especially those in the New York greater metropolitan area, where Rockland and Orange are. I think there's an Orange County in California as well, but it's not that one, it's the one in New York. Now, lots of you gave Wafafa money for coffee after the floods, and I have to tell you, he hasn't been spending it on coffee. Let's see what he has been spending it on.
Hello friends, we are in the field distributing relief food, planting nutritious seedlings, and teaching people about the prevention of waterborne diseases. As you are all aware, for those of you who have been following the videos, the floods were heavy in this area and they affected a lot of people, and as a result they became vulnerable to hunger, waterborne diseases, and then future floods. And today we are giving them those trees to plant such that they will prevent the future floods. The trees will also help to feed them, and also those trees will help to conserve the environment. The food that we give, we are here with one person. Papa, this this is Masete Patrick. Is one of the people who were affected by the flood. This is the mattress that was taken out. All those things, the bags and the books, were for his family. They were all swept, including the things that were in the house. So he was left with nothing but with children to feed. The good thing is that he survived death and none of his family members died, but he is vulnerable to hunger. So we are supporting them with the little that we have because of your support. So we are in the field. You're going to get more videos. Just make sure that you're on. So let's go. So this is the gentleman that I was telling you about. He's the gentleman who rescued a several number of people. I don't know how many they were, but he's going to tell us. I will ask him to first tell us his name. What's your name?
Emma.
He's called Emma Washuku. So Emma, on that day, how many people, or what happened? How did you come to know that people were drowning and you saved?
It was the night I was sleeping. Yeah? I came out. I was checking about that tower. Now I saw the water is there, has reached at the house, and I went there. When those ones are sleeping, I swim there. Those ones opened the door. Then I carried I first carried the two babies. I brought them this side.
How old were the babies? How many years? Hey, you come. This was among the baby you saved, eh?
Yes.
What is her name? Hello, what's your name, baby? This is who? Nandu to Agasa. This uncle carried you. Is it the brother? Oh, the brother. Oh, the brother. Oh, sure. So you saved this one.
Yes.
Then who else did you save?
Patient, Priscilla.
Okay, some of them have gone to play.
Now they're at school.
Oh, they're at school. Okay.
Yes.
So you said you first carried the children.
Yes.
You know how to swim?
I know.
Okay. So after children?
After children, we went there at the bridge. Others were there. They came with the car. The car entered from up there. Now they were there at the tree, but in the middle the river. But we swim with my friends. The others they are not around. We swim and we saved the one white and two. There were two whites, a man and a woman. It's the Africans, four of them.
Okay, great. But the thing is, he risked his life. He lost the property, but he did it for the good of other people. So thank you very much. Thank you for being a hero. Maybe if you had not yet gone to save them, maybe many people could have drowned and they could have died. Yeah, so thank you very much. In which class are you? Senior 2. Thank you so much.
I'm Kale Abdul, the chairman LC1 of Chaff Cell, Nabuyonga Ward, Northern State Division, Mbale City. I thank Buwanga Wet Health Foundation for the great work they have done. They have assisted my people of Kichafu, giving them knowledge. They have given them food. As a leader, I'm very, very happy. I'm still even waiting for the assistance from the government. So, this is the first chance we have had. It is a non-government organization, but the work it is doing, it is very grateful. And I want even the government also to see what these people are doing, because they are not assisted Chichaf only, they are still continuing to other places. So, help them, God.
Amen.
So that's what Wafafa did with the money instead of buying coffee. So that's pretty good. Now, at the moment, we're supporting 300 vulnerable families purely through the donations you made. So that's great. Immediate aid, food, education to prevent waterborne diseases such as cholera and typhoid, which can be so devastating after floods. and of course trees to provide nutrients, the nutritious crops, and prevent, there's nothing like trees for preventing future flooding as well as wetlands as well. So Emma, we'll call him the most modest hero. Well done, Emma. Rescued 4 people. If you saw the torrents of floodwater, you'll see what that guy did is really quite impressive. I'll put the link to the video about the flood so you can see that. And the Buwanga is the organisation that you've given the money to. It's a non-governmental organisation. There's no administration costs now, or if they are, they're completely negligible, and it's just what we have to work through. But basically it's this channel and Wafafa's medical videos channel. But of course we have to do it completely above board and legally by all the Ugandan laws, which we are doing. So if you supported that work, thank you very much, and that's the evidence of where the money went. And thank you for watching this video.